last night, Governor Gavin Newsom and the California Department of Public Health declared a state of emergency to support its ongoing efforts in response to monkeypox. Today, the County of San Diego is declaring a local health emergency for monkeypox to align our efforts with the approach taken by the state of California. This will also allow us to strengthen our county's vaccination, prevention, education, and treatment initiatives, and will help our county to be able to prioritize more resources such as vaccines when they become available in greater resource, and could down the line provide additional opportunities surrounding funding. Our county has taken the issue of monkeypox very seriously from the beginning, and those efforts will certainly continue in light of what we are continuing to see moving forward. We started mobilizing our monkeypox response near the end of May. Towards the end of May, last week of May, around May 23rd, working with our local health partners. In June, we began our public information campaign and efforts providing information, working with community partners and others. June was also when we had our first 2 locally diagnosed cases, and we continued to ramp up our efforts. In July, we aggressively began advocating with the federal government, both to Secretary Becerra and to other federal leaders, that we needed an increased availability of vaccines. This situation that we face today is fundamentally different than the one that we faced in COVID, and that there already is a vaccine, there is treatment, and we know much more about it. It is also order of magnitude less transmissible than that. But the reality is we need more vaccines, and we will continue to advocate and continue to push for a greater supply and availability of vaccines. The county's monkeypox website updates in real time the vaccine status in terms of how many we have received and how many have been administered. Right now, the County of San Diego has received 3,987 monkeypox vaccines, some of them just recently coming in, 3,987, just under 4,000. 2,454 of those have been administered, and 1,533 are being distributed or used by public health for those who have faced exposure. The way the vaccines are distributed by the state of California is based on a formula based on your population, your number of cases, a variety of other factors. The formula the state of California uses for the distribution to counties is also available and is linked to on our monkeypox vaccine page. And so we encourage people that are curious about how the state is allocating them to visit that site. As we get vaccines, some are held in reserves for folks who have faced exposure. We want to make those available and have those available for folks that have been exposed, and the remaining are being distributed to our healthcare partners and with our community partners to highest risk individuals based on a criteria of the risk that they face. We will continue to advocate and push for more vaccines. We need the federal government to move faster, to make more available to the state, and to get them done quickly. We've had 2 vaccine events where 1,400 San Diegans have received them. We've also provided testing and vaccines at our STD clinics. The county has already distributed 110 treatment courses to area hospitals, community clinics, and county clinics. People who have tested positive and are eligible for treatment can get that through their healthcare providers. To date, we've had no deaths and only 1 documented and verified hospitalization surrounding monkeypox. We've launched an aggressive education campaign working closely with community leaders, with partners, with healthcare systems. We do a standing weekly meeting that we have been doing where we bring in community leaders, our public health experts, elected officials, and others to talk about and hear concerns from the community about what else needs to be done, what should be done, along with sharing information surrounding what we're doing. We've also established a dedicated text alert system. Anyone can sign up for updates on monkeypox by texting COSD monkeypox to 468-311. Additionally, 211 has a lot of information surrounding monkeypox, and people that have questions are also encouraged to call them. All of our efforts will continue. We do multiple presentations. We have done 1 public town hall. We work with our healthcare systems and medical providers, and we will continue to do all of those efforts surrounding that. I also want to thank all of our area local elected officials who have been very engaged in this from the very beginning. I want to thank our mayor, who you'll hear from in a minute. Mayor Todd Gloria has been briefed, has met. We've had multiple conversations, has provided input, working closely. I want to thank our state leaders. President Pro Tem Tony Atkins has been very engaged, talking to the county, advocating with the state, pushing, and I want to say a special thank you to Jason Wise from her office, who's here today, and they've been a regular party to our stakeholder meetings and everything we've been doing. I've spoken directly to Governor Newsom about what we are seeing and what we are facing and where we need to go. I want to recognize and acknowledge Councilmember Stephen Whitburn, who is here with us today, who's also been very engaged in helping distribute information, facilitate conversations with the community, Assemblymember Chris Ward, and multiple colleagues here at the county. You'll hear from Vice Chair Nora Vargas here in a minute. I know Supervisor Lawson Reamer and her team have also been very engaged, and we will continue to work not just with our community partners who have been vital allies and partners in sharing information, distributing information, helping around vaccines and testing and getting all of that out, but also providing a critical link on what else we need to do and where we need to focus. As it relates to the local health emergency, I want to state the obvious. We have come out of a very difficult period around COVID. The situation we face in monkeypox is fundamentally different. This is a very different situation. We take it very seriously, and we are doing everything that we can to respond and move accordingly. But as I mentioned earlier, it is exponentially less transmissible. And we know more about it. We also have a vaccine at the start of this. Now, we need more of it, and we'll continue to push to have more of it. But having vaccines, having treatments, having something that is less transmissible puts us in a very different situation, and so it is fundamentally different than what we encountered during COVID, and our response will really rely on education, prevention, vaccination, and treatment. And we think those are the tools we have at our disposal, and we will continue to use those. I also wanted to share on our website, in addition to updating vaccines, we will, effective today, begin sharing the case counts every single day, and we will update that. Prior to today, we were doing them on Fridays. Today's website reflects 46 cases, which is where we are now, which is just what we had on Friday, plus what we've accumulated since Friday, and we will continue to update that every single day, Monday through Friday. We also will be adding to our website the demographic breakdowns, age, gender, ethnicity, other information surrounding the cases, and we'll continue to do that as we move forward. At this time, monkeypox outbreaks are disproportionately impacting our LGBTQ community, but we know that it can spread to others, and it is vitally important that we not stigmatize any individual, that we not stigmatize any community, or we not cast any aspersions. We have a communicable disease that is spreading through our community. It is predominantly now in one community, but it very well could spread to others. And so as we move forward in these efforts, it is vitally important that we not allow individuals to stigmatize or cast aspersions on a community. And we will continue to do everything we can to keep our community safe, to work with our healthcare partners, to work with our community partners, and all of our elected officials as we move forward, and we'll continue to provide regular updates around this as well.